When people hear the word morphine, they think, oh no, this might be the end, will this hasten my death?
It's probably had a bit of a bad press in the past, and that's usually because it's perhaps, like lots of medicines, might have been misused in the past. It's a natural thing for anyone starting a new medication to be a little bit fearful. As the illness changes, pain may change as well, and we may need to respond to some increase in pain.
Are there other options? Can they refuse to have any opioids? Welcome to the Life and Loss podcast. We're joined today by Dr Beverly Lee, consultant in Palliative Medicine at Forest Holme Hospice. Opioids, particularly morphine, play a crucial role in palliative and end-of-life care, but they're often misunderstood. Many people worry about addiction, tolerance, sedation, or even the fear that opioids could hasten death. Bev is here to help separate fact from fiction and reassure families and patients about the safe and compassionate use of opioids in hospice care. Welcome.
Thank you very much for inviting me today, Hannah.
So I briefly mentioned an opioid that a lot of people will be familiar with, which is morphine. I wonder if you can explain maybe some of the other ones that are used and why they're used in hospice and palliative care. Yeah.
So as you say, probably the commonest one is morphine. And actually, opiates themselves have been around for thousands of years. The evidence from documentation shows that the ancient Greeks and Egyptians used the opium poppy for its pain-killing effect. Mm-hmm. And certainly doctors and nurses in the UK use opioids a lot. It's probably one of the commoner drugs that we use, and it's very, very safe. Morphine's the commonest one that we would use, but there are other opiates as well, such as fentanyl patches, buprenorphine, oxycodone, just to name a few. And they usually come in a form where it might have what's called a short-acting use, so that works quite quickly, but only lasts a few hours, and that's very useful for someone who's got pain in the moment to help relieve their pain. Yeah. But we know that a lot of people, unfortunately, might get pain on a daily basis. So what we want to try and do is prevent the pain from occurring. So we might use more of a long-acting opioid in that situation. So morphine, we think about Zomorph or MST, or it might be the fentanyl patch. And that really works over a number of hours to help with pain relief.
And often we hear, when people hear the word morphine, they think, oh no, this might be the end, will this hasten my death? What would you say to people that have got that fear?
Yeah, I think you're right. It's probably had a bit of a bad press in the past, and that's usually because it's perhaps, like lots of medicines, might have been misused in the past. But actually, it's a really, really safe drug to use, used in the right way that we would use it, in a low and a slow implementation. And actually, again, there's lots of research studies that show that actually early palliative care and good symptom control, which includes using opioids for pain, actually brings people much better quality of life and can actually extend life. I think a lot of people think of morphine being used at the very end of life and, does that hasten my death? But actually, naturally, unfortunately, when someone is dying, they become more sleepy, they may not eat and drink, they may take to their bed and not be able to move as much. And that is the natural dying process, and all the morphine or opioid is being used for is to make sure that they're not in pain at the end of their life.
Yeah, and you briefly touched on there that they're used at the end of life, but they can also be used throughout someone's illness as well to manage pain. So if someone's worried about maybe losing their independence or not being able to drive, if they're taking a drug like morphine, are they able to continue driving?
Yeah, absolutely. So there's no contraindication for you driving and using morphine or opiates. You don't have to tell the DVLA. We do advise that you do let your insurance company know. It shouldn't affect the policy premium, but it just means that you've declared everything, a bit like you do for any form of insurance. Yeah. The only thing I would advise is that when someone starts taking an opiate, or perhaps if the dose increases, I would suggest that perhaps for a few days that they perhaps don't drive, just while they're getting used to that new medication. And then perhaps when they feel, actually I'm confident to feel like I can drive, go for a short distance, a familiar distance, go with a friend, go in daylight, and actually, as I said, continue to enjoy that driving and maintain your independence.
Yeah. And another common fear that we often hear is that it will mean that the person's overly sedated, so they're more unconscious and not able to interact with their family and friends. Is this the case?
No, certainly not. I've prescribed morphine for lots and lots of people, and certainly it doesn't cause someone to not be able to communicate. It can cause a little bit of drowsiness or sleepiness, and again, that's usually for when you start the medication the first time, a lot like a lot of other medications that we might start, or perhaps again if the dose slightly increases. But for most people that wears off within a matter of days, up to about a week. Occasionally, if you are thinking, actually it is making me feel a bit drowsy and I don't like this feeling, please discuss it with your healthcare professional, because actually it might be that we can look at reducing the dose down. Or, as I've said, there are different types of opioids. So for some people, if they don't seem to get on well with morphine, for example, they may find that changing to either oxycodone or a fentanyl patch, they don't get that side effect.
Yeah. And for those that are not used to taking any sort of pain relief drugs throughout their life, there can sometimes be a fear that they'll become addicted to some pain medication, or they might become tolerant to it or reliant on it, so without it they'll be in a lot of pain. What's the truth behind this?
Yeah, so again, in palliative and end-of-life care, when we're using opiates, there is really no worry about tolerance. We're using them to help with the pain, and the dose, there's no maximum dose as such that you can take. And certainly if the dose does have to be increased, it's not because you're getting tolerant to it. It probably is just because as the illness changes, pain may change as well, and we may need to respond to some increase in pain. In terms of addiction, I hear that a lot as well. And it's naturally a very sensible thing to ask and to sort of think about. But again, the painkillers that we use, the opioids, they do have physical dependence in that if you stop them suddenly, you might then feel a sort of withdrawal effect of the drug. So again, if you did want to think about stopping them, please talk to your healthcare professional, because we'd look at how we could do it in a more controlled fashion. But in terms of addiction, that's a very different scenario. That's people that are perhaps using drugs outside of what they should be used for and are using them even if they're still caught to excessive amounts and causing sort of physical or social harm. And in palliative and end-of-life care, we don't see that. If you've perhaps had a previous concern with addiction in the past, again, talk to your healthcare professional, because we'll make an individualised plan with you.
And I think that's important in the context of this conversation. It's all about people who are on the palliative care pathway or under end-of-life care, rather than general pain relief for other conditions.
Yeah.
I hope that you're finding this episode useful. Perhaps you have a question that you'd like to ask. You can do this by commenting below. Your input shapes the conversations we have and the topics that we explore, so don't hesitate to reach out and let us know what you'd like to hear more of. There's also a fear about impact on breathing, which I've heard before come up. Has anyone ever mentioned this to you?
Yeah, and I think we've all been there when we're giving a new medication and we sort of open the box and we get the medicine information leaflet out and it lists 101 things that the drug can cause, and it can look quite worrying. And certainly if you look at it for opioids, it will talk about affecting breathing. But again, the way that we use the opioids, we're using them very safely. We're using them at a very low dose to start with and only increasing up over a period of time. I've prescribed thousands of prescriptions for opioids, and I can count on less than the fingers on my one hand the people that have had breathing problems from it. It's a very, very rare occurrence at all. I think commonly it causes that condition when someone unfortunately is using opioids from a recreational addiction purpose, and perhaps they are using excessive amounts, and that's where the risk can be. Yeah. And in fact, we use opioids for people who have life-limiting lung conditions where their breathing might naturally be affected anyway, and actually it's been very good evidence to show that opioids really help someone's breathing in that situation.
Yeah. And what would you say to someone who's fearful, maybe under palliative care, and they're fearful about using opioids for pain relief?
Yeah, and again, I think it's a natural thing for anyone starting a new medication to be a little bit fearful, and they might have heard of people perhaps before that haven't got on well with opioids and things. So what I would say is please, talk to someone about your fears and concerns and questions. There's never a silly question at all. It's really important to understand. And as I said, what we would often be doing is looking at doing a very good pain relief plan for you that works well for you. There are some really good websites out there as well that can have information. So the Forest Holme Hospice website has got information on opioids. We've got a leaflet. But other websites such as Marie Curie, Macmillan Cancer also have really good information on opioids. The other thing I would say is that actually often people don't realise they've probably tried an opioid previously. So some of the over-the-counter medicines that we can get, like codeine phosphate, cocodamol, codeine linctus, actually the body breaks the codeine down into morphine, and it's the morphine that then provides the pain-killing effect.
Oh, interesting. Yeah. Final question for you, Bev, and it's about patient choice. So if they decide opioids are not for them, are there other options? Can they refuse to have any opioids, or is there more like a complementary or holistic methods of pain relief?
Yeah, and I think when we talk about pain, we always think that it's a sort of physical symptom, but actually pain is so impacted by how someone's feeling emotionally, socially, psychologically. So actually the analgesia side of things is only one part of how we can help approach pain. Yet there's lots of analgesics that aren't opioids, so we can look at other medicines, and we often look at medicines in combination, because actually we can then use the lowest doses of those medicines but provide a sort of additional effect as well.
Yeah.
But yeah, I'm a great believer in looking at non-medicine sort of approaches to pain. So some people find heat very useful, or cold, or at the hospice we've got an amazing complementary therapy team, and they'll look at using things like Reiki or reflexology, acupuncture to help with pain. And our therapy team, so physiotherapists and occupational therapists, can help, because sometimes people find it's certain positions or when they walk that the pain can be a bit more difficult, so we can look at ways to help that, and equipment and aids that can help. Yeah. As I said, it can be affected by sort of how you're feeling emotionally and socially, what's going on in your life. So talking therapies can also help, and the other things are things like mindfulness and relaxation techniques. There are great apps out there that you can use. So Headspace is one that I can think of that can really help with those sorts of things.
Thank you so much, Bev, and thank you for listening to the Life and Loss podcast. If you'd like more information on our work, you can visit our website, which is foresthomehospice.org.uk. Thank you. Please remember to like, comment and share this episode to help us reach more people. At Forest Holme Hospice Charity, we offer this podcast and many other resources to support people through life's most difficult times. If our work has made a difference to you, please consider making a donation by visiting the link in the description. Thank you.